You are nervous for your first intubation. My hot take is that it is totally normal to be nervous going into the operating room on your first. I think subconsciously, nurses also entering anesthesia training, we hold this association of intubation with RSIs or codes on the floor because the majority of times that we will have intubated a patient as ICU nurses, it's an emergency. So even though we're entering the operating room for scheduled and planned procedures, and it is incredibly safe to induce general anesthesia, I think that we all have this subconscious understanding of urgency and emergency. And then when you combine that with first day nerves and with being a perfectionist and being new and it being an entirely different environment, there's a lot of nerves that go into that. I have a whole podcast episode about this. This is the first induction of anesthesia episode of the Confident Care Academy podcast. Chrissy's a really good teacher and she's taught students for like 6 years. But as somebody who is only 1 month into clinical myself, I'm still nervous. And it's okay to be nervous, but also there's some things that we could do to kind of help mitigate some of our stress as we go. I'm a huge fan of talking through the steps to myself in the car for a new skill that I haven't done yet, or talking to myself on the floor, just like verbalizing the steps. Because what can we control as new nurse anesthesia residents? We can't control whether or not we get a skill on our first time. The only thing that we can control is how prepared we are to show up that day. For the experienced people, comment any tips that you have to like help with nerves. Check out this podcast episode.